Madam, we are live now.
Yeah.
So shall we start? Thank you. So good evening, doctors. Aishman from Shield Healthcare welcoming you all today in a very important and interesting session with Dr. Gauri Kumra Madam on art in A.R.T. So before moving into the session, let's have a look on our Shield Connect page, that is the knowledge sharing platform of Shield Healthcare. Here you can see the blog section where you can find all the related blogs in the many topics. And that blog has been endorsed by the different physicians across India. And these are the past webinar section. Already we have conducted many webinars in our platform and in different topics as well. By many doctors, and this is the PCOS awareness blog. Here you can find all the related things related to the PCOS, and not only the PCOS, we have many other blogs section also. Like this is the menopause section. Here you can find all the information related to the menopause. Likewise, there is another many awareness section also. You can see the PCOS, menopause, GDM awareness, immune booster, COVID-19, and thyroid awareness blog section. Apart from that, the most important thing is our key opinion leaders. Mostly, almost more than 500 doctors are currently supporting us this knowledge sharing initiative of Shield Healthcare. So I would like to request all the participants, please have a look on this Shield Connect page. It is a very informative in terms of our subject area. So now it's time to start the session with Madam, and it's my honor to introduce Madam. Madam is the senior obstetrician, gynecologist, and infertility facilitator in Bhagirathi Neotia Hospital, Kolkata. She is having more than 30 years of experience, having contribution in this drug research with Himalaya, Indigen, German remedies. In 2003, Madam got Dina Bhai Patel Award by AMWA, and she is attached with digital platform, Net to Teach colleagues on phone. Madam is the educationalist, columnist with Times of India and Your Health of IMA. She is also the artist for the last 10 years, which is very important. And she is also attached with written a book on art and infertility, mind and medicine, a book on painting. Apart from that, Madam is also associated with John Hopkins Institute Art and Mind Lab since 4 years. So with this short introduction, I request Madam to take over the session. And meanwhile, I request all the participants for your active participation. And if you have any query, please put your queries on the dashboard of the Shield Connect page. So once the talk will be over, we shall have a short discussion on this topic with Madam. So thank you, Madam, and over to you, ma'am. Kindly full screen it. Go to slideshow. Slideshow. From beginning. Go to first slide. It was visible. Please stop sharing. Just 1 minute, madam. Is my screen visible? Madam, is my screen visible?
Yeah. No. No.
Chitra, can you help?
Yeah, your screen is visible, Suman.
Madam, can you see the screen? What I shared?
No. No.
Everyone can see. Okay, let me share again. Is it visible?
Yes, Suman.
Madam, at your end?
Am I audible?
Yes, ma'am, you are audible. Can you see the screen?
Yes, I can. Shall we start?
Yes, madam.
Good evening, friends, seniors, juniors. Happy New Year. Let's hope we rock through 2022. And thank you, Sheel, for giving me an opportunity to share my thoughts on art in A.R.T. At present, due to the pandemic, the patient and physician relationship has to become passionate. We have to increase the comfort level. So I will start by telling you something about my painting. This is a painting of Fascinus, the winged phallus, which is revered in Rome as the fertility god. It's symbol of fertility. Do you see this winged phallus? This winged phallus, behind it lies the phoenix bird. The phoenix is supposed to come out of the ruins, rise, and then merge with the ruins. So life, birth, and death are to be taken with the same equipoise. And of course, you have the ovum here, ready to be penetrated, pierced by the winged phallus. So when a patient, a couple who enters an IVF center, A.R.T center, and sees a painting like this, the presence of mind is commanded. The presence of mind, mindfulness, alertness, and awakening arises. So we take them a step ahead. That is to the next painting. This is cognitive resonance. What is cognitive resonance? Here you see the divine femininity, the portal, the inlet, and there are biochemical reactions. And this is act of copulation, where the serpent is symbolic of desire, and the integration between the man and woman results in creativity. So this is cognitive resonance. I personally feel that when we enter an IVF center or a clinic, we see a lot of awards, a lot of credit to the IVF center, but this does not comfort the patient. The patient would be hypnotized if there is some color display, and that color display would enhance alertness, involvement, and would reduce the fear factor, the doubt, the apprehension. So cognitive resonance is very important, and the physician has to do cognitive engineering through the clinic, through the staff, and through the physician himself. Physician has to wear a smile in this pandemic era where we've gone through a lot of uncertainties, a lot of doubt, and a lot of fear. Now, when the couple enters my clinic, I subject them to a psycho-emotional evaluation with a blob tree. So it's just like a couple acting like children coming to my school, and we are doing quiz. And I ask them, which man on the tree do you like? So that equates to the emotional grading. This was designed by Mr. Pip Wilson, but there are certain errors in this emotional grading, and University of Baltimore has devised another picture which has mustard mountain method. So, this enables the couple to thaw. They are surprised, they are taken aback. What is this that we see? Next slide is slide of color consciousness. So I give them a set of pen pens, and I ask them to make a social prescription. They are to design their social prescription with the choice of colors. And the interpretation of color is name of the color, the frequency of color, the associated emotional state of that color, and view of life. So they are totally mesmerized that we have come here for a child, and doctor is putting us through emotional grade scale. Well, I want to indulge in transparent thinking. I want to make them comfortable. I want to make them smile. After color consciousness is developed, then we move on to this act where I bring out self-emergence of the couple, try to erase their shadows, their fears. Many husbands, many men do have a lot of issues. Some have gone through child abuse. Some are intimidated by ghost concept. Some have had rejection phenomenon. So they are carrying that shadow, and they're not able to share it with their spouse or their parents. Well, the physician steps in. The physician is going to bring the conscious and the subconscious mind to make it a wholesome mind, a comfortable mind where the couple can talk. So how do I do this? This is a format I've designed where I set dreams of baby visualization, where the baby is growing from 2 cells to multiple cells to an organized body. And the answer to be given by the couple is their details, their personal details, whether they've experienced COVID, whether it was symptomatic or asymptomatic, are they falling into the long COVID stage, the choice of color, then their personal details about sperm test, about AMH, BMI. So this is listed in that form of baby visualization. And I grade their interpersonal relationship. Are they compatible? Are they tolerant? Are they incompatible? Thanks to Buddhism and the Eightfold Path, I have calibrated this cycle which defines friends and family, fitness and health, career, money, personal and spiritual growth, romance and relationship, negative thoughts, fun and recreation. So both husband and wife plot on this, and one can decipher whether they are coordinated or there is cognitive dissonance. Now, from this page, we jump to this page where I motivate them, where I say, you have to give the dose to yourself. What is dose? Dose is dopamine liberation from your system. How? It's a reward hormone. So start believing in positivity. Every success you attain, you give a pat on your back. And oxytocin, O stands for oxytocin, that is love hormone. At times, do catch each other's hands. At times, smile at each other. You cannot be brooding and sulking. And then serotonin liberation will happen with meditation, with mood control, with tantrum control. And say bye to endorphins. Shoo fear, shoo stress, and shoo pain. You have to stimulate the hippocampus, amygdala, and the hypothalamus. You have to lower the cortisol levels and bring about a surge in dimethyltryptamine so that you are positive. And this is how I work through emotional grading, through color, through tree sight, through wheel of life, and then art in A.R.T. So they make their social prescription. Now, this is cognitive bias. Those patients who have conceived with me, they have gone through this mental health coloring. And today, in today's time, when we have LGBTQ community and where Sita is put at the back, Draupadi is put at the back, and Shrikhandi is coming in the forefront. We as physicians have to be more liberated. We cannot express shock. So this is a platform where I share some of the drawings done by the male and some sketches done by the woman. And through this, I find out whether the couple is mismatched, whether there is EQ and IQ disparity, when there's non-congenial home environment, the woman is going through oppression by the mother-in-law, or there is financial disparity. And during the pandemic, we've all experienced financial disparity and a setback. Sometimes the woman goes through a lot of upheaval when the husband is working elsewhere and she has to stay in the family and is oppressed. So this cognitive bias is spelled through these diagrams. So there is verbal acoustic disparity. This verbal acoustic disparity is identified between the couple and the physician. The physician knows a lot. The couple only knows fear and doubt, and also is aware of social stigma. So there is a dissonance. It's the job of a physician to make the couple friendly, fearless, heartful, mindful, have presence of mind. And the same applies to the husband and wife equation. If the husband is aggressive and a breadwinner, and the wife is listless and is always snubbed by the husband, there is dissonance. When there is dissonance and listlessness, then there is cognitive bias. And this disturbs the biological psychiatry of the individuals. How can they emote? How can they create? How can they express if there is no understanding? And this also alters the epigenetics. It also leads to carbohydrate craving. When there's a lot of word exchange, lack of understanding, there is alcohol formation in the gut. The gut is strewn with trillions and trillions of neurons, which relay faster than the nervous system, to the brain and the brain goes dull. So it is so important to wipe away this dissonance, to bring in resonance, and resonance can only come with art and creativity. And that is how art in A.R.T is very, very important. So in these 20 years, while my patients did drawings for me, I calibrated them into 3 modes. The tricksters. Tricksters are those who stay abroad or stay away from the family. So they have dual persona and they resort to this shading, or they would draw a flower with a pot at an angle, or very expressive eyes, or they would indulge in mathematics and graphs and beguile the woman sitting at home, or maybe pranksters. Those with communicative mind go back to the childhood. They display the childhood innocence of seesaw, of the village, of well, and of a tree growing up. And those who have ejaculatory dysfunction, and those who are impotent or have some fear factor in them. There you see the drawings are like a dinosaur or a rat, or maybe calculation, or maybe a roof which is like a boat, or a angled triangular roof. So this is a silent mode of speaking. It is a non-verbal communication where the physician has to be receptive and perceptive. Likewise, the female ego has been calibrated into 3, where there is anxiety and restraint. She's a working woman, she's a teacher, and she has to come home, she has to do the household chores. So how does she express? She goes into detail, or she may draw with the pot upside down, the flower small, the bud big, or may draw a sagging teddy bear. On the other hand, a corporate queen would immaculately present a drawing with details, with a roving eye, with a clown act, with mathematics. There's a lot of cherish in her mind. And the ones who go through body shaming, they again are very deceptive in their sketches. And they start off by saying, I'm bad at drawing, I cannot draw, or would go into mathematics, would go into crucifixion. And of course, the children, the girls who are abused, would also draw a house on a triangle, which is not balanced. And there's a tree floating, symbolic of God and of help and of understanding. So it has evolved me as a human being. I have learned through this non-verbal communication how to make my patients comfortable and how to trigger a biochemistry which will obey the body after they've been heard. My special plea to all the IVF centers is, please create cognitive resonance by making the sperm collection room immaculate. At present in India, we expect our men to go to a dirty toilet soiled with urine to go and give a sample of semen. This is cruel. How about giving a 50 square feet room with little bit of art in it? Let's be compassionate. Let's be little careful, mindful, aware. So the waiting room where the patients are sitting and waiting for the doctor, if he were to give fractalgism, that means look at this painting so carefully. If you keep watching it, it will show a cat's face or a mule's face. Look at this micro mini details. Look at this motion going through space. This is all auric healing. And these paintings will set a positive chemical reaction in the body. The gut integrity would get tamed. That acidic content would get reduced. We have to feel, we have to make them comfortable. They are going through a lot. So how does meditation help? Meditation prevents fermentation, putrefaction, avoids alcohol synthesis by overcoming sensuality. Remember that the concept of having sex and going overboard with sex is predominant when we are young and our hormones are on the surge. Banal thoughts are there, and a lot of ignorance is there. If we meditate, meditation is not far-fetched. It is not difficult. All you have to do is know yourself without the ego. Let go of the ego. Feel yourself. Try and restore your biochemistry. Why as patients, you rely and put everything on the physician? Why not work yourself? Why not be prepared yourself? So you must be compassionate. You must accept lessons where you have to tame yourself, show gratitude, streamline yourself, and then come to us for help. We are ready to give you that help. So art in ART enhances success and gives fruitful results. So my thought of art in ART is just the beginning to make you couples more approachable, more communicative, and cherish the outcome which we have to offer as physician. For the doctors, I would like to say that doctors, most of us use iPhone, most of us use expensive things, but expensive things, when they fail, they have to go through repair and it is expensive. And the companies are manufacturing, upgrading newer models, which are becoming more expensive. So now the companies have resorted to digital self-repair. So everything is outlined on the net and you can repair your own mobile. Likewise, we are constantly sitting. We should take care of our posture and we should know the weight of the neck over the shoulders. And with age and with sedentary job, we are also going to succumb to a lot of changes. So doctors and physicians, we need conscious living and postural correction. We also need to generate the dose within us. So with this confidence, couple is ready for ART and the mind has to order fear to drown. There is no place for fear. There is only place for confidence. And I have come to an end of my session where I sincerely and truly feel that creativity and art will give us cooperative couples, and we, with our cognitive resonance and our engineering skills, will be more successful in dispensing assisted reproductive technique. Thank you.
Thank you very much, madam, for this nice presentation, how you correlate all the things in terms of these emotional gradings, starting from color, verbal, acoustic, disparity, and many more. So just give me 1 minute time to check whether any discussion is there or not. Madam, just one discussion, that is like emotional grading, color, and verbal acoustic disparity, how it is impacting this A.R.T. What is your practical observation on that, ma'am?
There is a lot of fear factor that the couple cannot create, and they have to go to a doctor for pregnancy. So either the woman is suffering from polycystic ovarian disease, or the man is having disparity in motility and morphology. There is a lot of fear factor, a lot of endorphins being liberated, and they are not able to communicate. So they sleep late, there is acidity, there is irregular bowel movements. So when we divert their mind towards art and skills and ability to enjoy life, we have virtually forgotten how to enjoy life, because we are all result oriented, career oriented. So when we divert their mind, they start relaxing, the body starts obeying, and the body starts generating, and they respond. And when they go to a doctor with diabetes, with anxiety, with insomnia, and inability to control their anger because of failure, which is banging at the door, if we are friendly, and if we give them time to reduce this hostility, the comfort level will improve and they will respond better. But when a couple comes and we tell them that AMH is low, so I don't think you can, we will give you medicine, but you may have to seek ovum donation. This itself will make the woman very resistant. Or if a man has had an accident and is not able to have proper erectile function, that waiting period is very traumatic. During that period, counseling and thawing their fear diverts their mind. They start contributing to self-healing. We have to instill passion into them. We have to be compassionate. All this is time consuming, and it's not possible for IVF centers to give this much of time, but we can have a special counseling, online counseling, where they can come converse with us, share with us, and we can bring them on the platform. Once they approach the IVF center, they should walk very confidently, and they should be aware it's not impossible, it is possible.
Thank you very much, madam.
So color will increase the frequency of the body, will increase the frequency of the mind, and will bring in more mindfulness. We must remember that we are all integrated, we are all interconnected, and we are all interdependent. The role of a counselor is equally important prior to the protocol which the patient has to follow. It is very depressing for them to come again and again for sonography, for ovum pickup, so there has to be place for compassion.
Thank you very much, madam, for such a nice deliberation. And we also understood that how art is directly related with these A.R.T. techniques, apart from all the methodological or direct protocol of treatment procedures.
It helps in mindfulness. It helps in mindfulness, presence of mind.
So thank you very much, madam, for your valuable time and for such a nice discussion on this art in A.R.T. In future also, we will look forward for some valuable session with you, madam. So thank you very much once again, madam. Have a good day, ma'am.
Thank you. Bye-bye. Have a nice 2022.
Thank you, ma'am. Thank you. It's been a pleasure, having you on board, and nice to see you after so many years.
I hope you enjoyed. Are we off?
Yes. Yeah, no. It was really, I think we are still live.
Oh my God.
Yes.
Shubhan, can we go off?
Yeah, we should go off, but we should be lively, isn't it?
Yes.
The
Yes,
whole
ma'am.
Just
the
one
whole-
minute, sir.
Are we off?
No, we're still
No,
there,
madam.
right? What you said is absolutely right. I agree with you, because even you will find that mindfulness is something which is being spoken of, and especially during this pandemic. Even I have this iPhone on which this, it pops up that, have you had your 1 minute of mindfulness? Have you been able to, be you, what you are, and have you been able to relax? I think that's a wonderful concept which you have brought in, and especially I know I can relate to many couples whom I know and have undergone A.R.T. It's a stressful process. It's absolutely a stressful process.
It is a
It's
stressful
not.
process. And then, when you conceived,
Yes,
after that, the protocol says, be careful, you might end up in abortion, be careful. So you're anticipating abortion.
absolutely.
There has to
Sir,
be
still we are
something.
live.
Oh,
We have not stopped yet.
It's okay. I think we are talking relating to the subject itself. So I think it's fair
yes,
enough,
it's an
Doctor.
informal conversation. And we have to motivate people that even physicians have a right to be friendly. We can't be so stern.